Hi guys, welcome back to the channel. So last class we have finished with one of the modality, surgical modality. उसमें भी we have finished with resection, peripheral resection and continuity resection. We'll be seeing some points of ostectomies and we'll be starting today the different modality for the cancer treatment. That will be neck dissection. Okay, let's start. So, vertical subcondylar ostectomies of the ramus, which preserve the condyle and the posterior border of the ramus, are preferred. So, vertical subcondylar ostectomy में क्या होता है, वो कॉन्डाइल और पोस्टीरियर बॉर्डर ऑफ रेमस को प्रिजर्व करते हैं. सो दिस टाइप ऑफ ऑस्टेक्टोमीज इज preferred. Now, coming to horizontal ostectomies, which also preserve the condyle but leave the coronoid process and temporal muscle pull to displace the proximal segment. तो ये क्या करता है, हॉरिजॉन्टल ऑस्टेक्टोमी, ये कंडाइल तो प्रिजर्व करता है लेकिन कोरोनॉइड प्रोसेस और टेम्पोरल मसल पुल कॉज करता है जो कि डिस्प्लेस कर देता है प्रॉक्सिमल सेगमेंट को. तो एनी डिस्प्लेसमेंट आफ्टर द सर्जरी इज नॉट गुड, are largely unnecessary and certainly not required, and it required rigid internal fixation plates to prevent proximal segment displacement. तो अब इसके लिए हमको rigid internal plate fixation करना होगा ताकि ये proximal segment displacement ना हो. That's all about the principles and surgical treatment. Now coming to okay. So I am describing in very brief because I have started a topic called cancer. वो क्या है, कैसे होता है, कैसे आगे बढ़ता है, इसलिए I am giving very brief idea about the treatment. अब जैसे जैसे we'll be studying different type of cancer, we'll be dealing the in detail the treatment plan. Okay. Now coming to the neck dissection. So this is the schematic representation of neck and the muscles and the level of lymph nodes present, or the 5 level of neck I have shown only. There are many but I have shown 5 only. Okay. Now first is this submandibular region between the anterior and posterior digastric muscle. This is the ioid bone. This is omohyoid का anterior belly. This is posterior belly. This is sternocleidomastoid muscle and this is the trapezius muscle. So there, this is level 1, level 2, level 3, level 4 is behind, then level 5. Okay, these levels are important in neck dissection. Now the biological principle of in-continuity neck dissection is that the lymphatics and the lymph node chains in the neck are contained in the cervical fascia and in the fatty contents around the cervical fascia of the neck. जो lymphatic और lymph nodes है, they are contained in the cervical fascia and in the fatty contents around the cervical fascia. Okay, basically two type of neck dissection is there. The traditional, which is complete neck dissection, and it is the most extirpative one, मतलब उसमें सब remove कर देते हैं. Now the functional neck dissection of Boca and Pignataro, often called Boca neck, and its many modification. पहला हो गया complete और complete और traditional neck dissection. सेकेंड हो गया फंक्शनल नेक डिसेक्शन विच इज़ गिवन बाय बोका एंड पिग्नाट्रो, और उसका बहुत सारा मॉडिफिकेशन है सच एज सेलेक्टिव नेक, प्रिजर्वेटिव नेक and supraomohyoid neck dissection, and they are least extirpative. Okay, they are least extirpative. Now coming to complete neck dissection, it includes the extirpation of the SCM, that is sternocleidomastoid muscle, the internal jugular vein and the spinal accessory nerve in composite with the lymphatic contained in cervical fascia and fatty content. तो ये इट इज़ द, इसमें सब कुछ निकाल देते हैं. including the sternocleidomastoid, internal jugular vein, spinal accessory nerve, along with the lymphatic contained in the cervical fascia and the fatty content. This surgery extirpates the fascia from all 5 levels in neck. Okay, we'll be continuing this in the next class. Till then, like, share, subscribe and comment. Bye.